Hospitals from London to Newcastle, Belfast and Glasgow, doctors' surgeries from Buxton to Brighton, all caught up in the coronavirus outbreak as it continues to spread across the UK.
I think it is more likely than not, and I'd probably go further and say it's much more likely than not, that we are going to deal with a significant epidemic. How big it is, I think, is currently still pretty uncertain, but that there will be an epidemic, I think, is now highly likely.
87 people have now tested positive for coronavirus in the UK, with 32 new cases in England. 30 had recently travelled from outbreak countries or linked to clusters already under investigation. 4 contracted the virus in the UK. Their links to others are still being investigated. Tonight it emerged 2 patients treated here at London's King's College Hospital subsequently tested positive for the virus. The hospital says it's restricting access to affected areas, and Public Health England is tracing possible contacts of the patients.
With so many countries now being affected, we know that we are going to receive more cases from overseas. I suppose that it's a bit more concerning when we have cases where we don't know what their travel history is, so there is no travel history and we don't know what their contact history is, and trying to identify how they could have become infected.
It's a busy time for this protective equipment manufacturer in Milton Keynes. They make pop-up isolation rooms, ideal for providing extra space for keeping patients suspected of having coronavirus separate from others in hospitals or GPs.
Because they are so quick to go up, at least you know you're only going to be in there a short while. This is purely for triaging, so able to see a doctor, able to see a nurse, give a sample, and you're gone again.
They also make equipment for the sharper end of coronavirus care. They've had hundreds of orders for these isolation pods for people who are acutely ill. Now, only the minority of coronavirus patients would ever be unlucky enough to see the inside of one of these, but they could make all the difference in keeping healthcare workers safe from someone who is highly infectious. For now, the NHS has the capacity to deal with demand for testing and isolation with existing hardware. Here in Antrim, they're offering drive-through testing to keep pressure off the main hospital. But the virus is putting pressure on primary care. More than 22,000 patients are registered at these GP practices in Devon, which will be closed for 12 days following a positive coronavirus case.
The NHS is very good at reprioritising, so those in greatest need will be treated. Sometimes that can mean that operations will be cancelled or postponed so that we can accommodate those who really need it most.
Today, the government launched its first coronavirus ad campaigns. The strategy remains containing the virus, but the escalation in cases signals a new phase in a growing outbreak.